Hi everyone, my name is Paige Bethune and I'm an athletic training student at Chatham. And today what we're going to be doing is talking about your PPE or your pre-participation evaluation, and we're going to talk you through all the stations that you will be going through to get you ready for your sport. So first I'm going to send you over to Alyssa so she can talk about paperwork and what you'll need to bring with you.
Hi, my name is Alyssa. I'm a student athletic trainer that's going to be conducting the paperwork portion of the PPEs. Each athlete will bring a signed consent form, and if you're under 18, then a parent or guardian must also sign this consent form. It's just a consent form for us to conduct the PPE with you. And then each athlete will also bring a medical history form. This form just outlines any past injuries, past illnesses, or any current signs or symptoms that you might be having. And we'll look at that prior to the evaluation, also at the end to help us make any referrals. And then throughout the exam, athletes will carry a form that we use to record any of our findings throughout the PPE on. And then at the end, I will go over all the findings and then help with any referrals that might need to be made.
Hi everyone, it's me again, and you'll be with me for vitals. So, I'm here to tell you what to expect and what I'm going to need you to bring with you. So, for what I'm going to need you to bring is I'm going to have you go to a CVS or a Walmart and use their blood pressure machine, and there you will get your blood pressure and your heart rate. With those, I want you to either take a picture or write them down and bring them along with you. And then for your height and weight, you can either use your most recent height and weight, write those down, take a picture, bring those with you, or in the Chatham chapel in the basement, there is a place where you can get your height and weight, and you can write those down and bring those with you. For your height, I would like for you to stand straight up, back against the wall, flat feet, no shoes. Okay? If you have a thermometer, it'd be great if you brought that with you so we could take your temperature at the time. But if not, that's fine. I'll just ask you some questions about your temperature around the time, just to see if you may have a fever or not. And then I also want to get your eyesight, so don't worry about bringing anything for that except your glasses. If you wear glasses, then I need you to bring those. And that should be about all for your vitals. I'm gonna send you over to the next person.
Hello, my name is Robert Warren. I am an athletic training student, and I will be going over your medical and thorough evaluation and giving basically a quick overview of what things you should be expecting and what would be kind of expected of you. So, for the medical portion, this would be difficult to perform with us over the phone and needs a more of a in-person kind of touch to it, seeing as though a lot of the things will be auscultations and impalpations, and all that just means is we will be listening to sounds and then as well as feeling for any abnormalities as well as taking like pulse. So a couple things that we will be doing in this portion would have been listening to lung sounds. We would also be looking at your ears, nose, throat, and eyes, which we would use some special tools for that, as well as we will be going over like the abdomen. So we'll be listening to any abdominal noises or sounds, as well as we would be also palpating to feel for any abnormalities. This is why I would highly recommend that you see a PCP to get that more in person. For the ortho portion, we will be going, the camera needs to be set up in a manner that you can get full view of your body, because we will be going through ranges of motion and as well as functional movements such as like, squatting, jumping, walking, and then doing like a duck walk. So a couple of range of motions or at certain joints we're going to be looking at is going to be at the upper extremities and then as well as the lower extremities. Some of the parts we're going to be looking at is the neck, the shoulder and arms, elbow and the forearm, the wrist and hand, And then for the lower extremities, we will be looking at the hips and thighs, the knees, the lower leg and ankle, and then as well as we'll be going over the foot. And then after all that is said and done, we will also be looking at the back. And essentially what we ended up having you do is we'll give instructions. So we're just gonna have in a certain manner. We might tell you to, 1, tilt your chin down to your chest as far as you can, tilt your head back, and then we might have you rotate your head to the right as far as you can. And pretty much every single thing we'll follow up with the question of, does that bother? Is there any like discomfort, tightness, or any pain? But I look forward to performing your ortho evaluation. Hope you have a great day.
Hello, my name is Hayden Fox. I'm an athletic training student at Chatham University, and in my section of the PPE, we are going to be going over your medical history and any disqualifications or things that we as athletic trainers should know about for your participation in sport. In your medical history, we'll cover things like previous injuries, concussions, any illnesses or conditions that you may have. Also with these comes disqualifications that if we flag anything, we will talk to you about and communicate with to better understand your conditions so that you are able to participate in sport. If we do see any of these complications, we will start the process of a referral to a doctor so that we can try and get things figured out. To recap this information, there's a link to a presentation below that also covers each section if needed. Thank you.